Good morning, everybody. Is there a nurse in the room? Good. We are very lucky because you are at the heart of the health sector. And today there are a lot of, somebody is waving, people there, look, she's over there. Because there are so many solutions made by nurses at this moment. So today we have a lot of attention in keynotes, in breakouts, and in the afternoon we have Rebecca Love, and she is the one in America who is mind-blowing, energetic about your role in the health sector. But as every day, we start with the Ministry of Health, Welfare and Sports. In our midst is the Deputy Secretary General, Abigail Norville. Abigail, where are you? Please come on stage. She is also the chair of the Global Digital Health Society, and they work and collaborate together for standards and innovative solutions. Abigail, I was wondering, your ministry is here now for 3 days.
Yes.
What is your feeling about the conference?
I haven't been here myself for all the days.
Yeah, but what do you hear from your colleagues?
What I've heard is that it was very inspiring, and that is very elevating to see all the things happening here, and also the energy of the people who attend. So my people are very enthusiastic about those 3 days.
Yeah,
yes.
And I hope you will tell something about positive collaborative initiatives.
Yes.
Globally, but also in the Netherlands.
Yes, I will do my best. Thank you. Yes, good morning, esteemed colleagues and also guests. I just said to my neighbor, I hope there are also international people over here, because everything is in English. It's not my first language, but also beware, people of Limburg, I can understand the dialect. So, you know, I'm from the north of Limburg. I cannot speak it, but I understand it. It's an honor to stand before you here on this final day of this year's ICT&health World Conference here in the beautiful city of Maastricht, birthplace of the European Union and a symbol of international cooperation. My name is Abigail Norville, and I'm the Deputy Secretary General of the Dutch Ministry of Health, Welfare and Sports, and chair also of the Global Digital Health Partnership, a collaboration of 40-plus country governments and the World Health Organization, formed to support the executive implementation of worldwide digital services. I've been informed that the past 2 days were packed with insightful speeches, engaging discussions, and inspiring collaborations. A range of innovative solutions were presented, and many valuable perspectives were shared. The richness of perspectives is precisely what we are here for, because at the heart of my commitment to promoting international collaboration in digital health is a deep belief that we can only address the significant challenges in healthcare by joining forces and embracing the diversity of perspectives available to us, doctors, scientists, nurses, everyone. Whether a country is large or small, wealthy or resources constrained, advanced in its digital transformation, or just beginning, every perspective brings value. In fact, some of the most refreshing and innovative insights often come from those who are navigating challenges with limited resources or starting from scratch. These perspectives challenge us to think differently and enrich our collective approach to advance global health. Only by bridging gaps, valuing all voices, and acting together can we collectively tackle the challenges facing healthcare systems worldwide. And those challenges are pressing, so let's make it happen. Let me start by sharing something about the Netherlands, a small country in Europe and even smaller on a global scale. Yet it has managed to leave a considerable mark on the international movement of digital health. In the Netherlands, collaboration has always been part of our DNA, from our centuries-long fight against water to being one of the founding members of the European Union. We have always believed in the power of constructive cooperation. Together, we can achieve more than any of us can achieve alone. This commitment to collaboration has allowed us to play a pivotal role on the international and European stages, despite being a relatively small nation. During the European health data space negotiations, for example, Dutch representatives were instrumental in bringing differing views among member states, constantly keeping the central goal of the EHDS in focus. This role was entrusted to us partly due to our collaborative work within the European e-health network during the COVID pandemic. Together with other member states, we developed the European Digital COVID Certificate in just 6 weeks, establishing the specifications and rolling it out across 31 countries within 2 months. Eventually, 81 nations adopted this system, which has now evolved into the World Health Organization's Global Digital Health Certification Network. Together with national and international partners, we're also working digitally on plans for the use of AI in healthcare to reduce administrative burdens and to make sure that healthcare remains high quality, accessible, and affordable for all. Another example of our efforts to drive the digital transformation forward is our chairmanship of the Global Digital Health Partnership, of which I, as chairperson, am particularly proud. Following in the footsteps of Australia, India, and the United States, the Netherlands now successfully leads this collaborative network of national digital health authorities and the World Health Organization, aimed at fostering international cooperation, sharing best practices, and driving innovation to improve healthcare systems worldwide. The Netherlands' dedication to advancing innovation in health and life science is also reflected in the fact that we house some key organizations like the European Medicine Agency, the EMA, the European Patent Office, the EPO, and the global headquarters of HIMSS in Rotterdam, where I live now. Together, health and life sciences contribute over 7 billion to our economy annually, with an export value exceeding 50 billion euros. Our healthcare system consistently ranks among the best in the world. And we are second in the Commonwealth Fund's rankings for high quality care and fifth in the Global Innovation Index by the World Intellectual Property Organization. Why am I telling you all this? Sharing these achievements is not a matter of self-congratulation, but a reminder of the standards we strive to uphold and the responsibility we share to support global progress. It also demonstrates that every country, big or small, can contribute to and benefit from the global advancements of digital healthcare. Let me share some more examples to illustrate how countries, regardless of their size or resources, can contribute by taking concrete steps or by offering valuable perspectives and raising important questions. Brazil, last year G20's chair, and I was very honored to attend the G20. With great ambitions in digital health, Brazil started using the International Patient Summary, a standardized document containing a patient's most recent and critical information, as a tool to give citizens more control over their health data. The GDHP has played a significant role in encouraging the adoption of the International Patient Summary on behalf of the G7 and the G20. In Austria, the host of the 13th GDHP summit last year, the Elektronische Gesundheitsakte, the ELGA for short, was developed. This electronic information system ensures that health data, most recorded and stored in a standard manner, are accessible nationwide and across institutions, anytime and anywhere. And during the first day of this conference, some of you had the privilege of listening to Peter O'Halloran, Chief Digital Officer at the Australian Digital Health Agency. As an active GDHP member, Australia, like the Netherlands, has published a national digital health strategy, complete with a roadmap and supporting legislation. Together with the Netherlands, Australia is strongly committed to achieving semantic and technical interoperability, built on international standards such as SNOMED, CT, and FHIR. In discussions about health information systems with representatives from Nigeria, a large country with almost 250 million inhabitants, but with limited resources and significant public health challenges, they candidly shared their struggle and said, health information systems, we don't even have a system, and we don't have the budget to build one. These conversations offer fascinating insights and invite us to reflect to the diverse starting points countries face in digital health transformations. Interestingly, being further along in digitalization isn't always an advantage. Take the Netherlands, for example. While we have made significant progress, much of our time and budget is consumed by maintaining existing but outdated systems, which leaves less room for innovation. In contrast, countries starting from scratch can focus all their efforts on building modern, efficient systems without the burden of legacy infrastructure. But this all highlights the unique challenges and opportunities each country faces, and it underscores the importance of sharing experiences and learning from another to advance digital health globally. Every country has questions when it comes down to digitalization, and none of these questions are simple or have straightforward answers. What should we standardize to make healthcare more effective? And what should we leave to the professional judgment of doctors and nurses? How can we leverage the innovative power of the health IT industry without becoming overly dependent of their systems? How do we harness the opportunities of AI while respecting citizens' fundamental rights? How can we manage the immense complexity of networked healthcare, information flows, and the needs and demands of all stakeholders, patients, citizens, doctors, nurses, vendors, policymakers, and researchers? Just last week, the leaders of national digital health authorities from over 20 countries, along with representatives from the WHO and OECD, gathered in The Hague for the 14th GDHP Summit. Their discussions centered around these tough questions we all face and the answers we strive to find. And over the past 2 days, here at the ICT&health World Conference in this beautiful city of Maastricht, we have explored how the Netherlands and other countries are working on the answers. Dear colleagues and guests, the challenges before us may be complex, but they are not. We can overcome them. I firmly believe that by continuing to work together, sharing experiences, knowledge, and the best practices across borders, and also valuing each other's perspectives, we can develop solutions that work for everyone. The time to act is now. Thank you.
Thank you so much, Abigail.
Yep.
I was wondering, yesterday, thank you. Yesterday we were talking about the gathering of data, which is very important. And you talked about the burden which we have here in the Netherlands, because we built in a very early age already the digital EPDs, for example. And several people in the audience said, well, the problem of the data that we have is that they are for the, let's say, the billable hours instead of the healthcare data. So the interoperability, but also the exchange, is not very interesting, for instance, for science improvement, etc., and also for treatment. So how can we change that? Do you already work on that?
Yeah, we try to incorporate all perspectives, but I also think it's wise to be open and clear about what it can bring and what it doesn't bring. And I think in the past we were maybe too ambitious that an electronic file would solve everything. like now, if you do it on paper, it doesn't solve everything. So I think we really need to decide what we want to solve, why we want to solve it, and who benefits from it. And that you also have to choose maybe who is not benefiting from it. But it is a choice and not something that's just happening.
Yeah, but will you encourage, as a Ministry of Health, that we also collect data in the EPDs for improvement of healthcare instead of billing the insurance companies, etc.?
Yeah, well, I don't think we only do it to build insurance companies. But yes, but I think we have to start. I mean, we already started, but we have to do it in phases, because if you make it very big and want to solve everything at once, I think that is a failure or a road to failure. If you look at, for instance, at how the banking society, the banks, the big banks, have done their ICT projects, I think at first when you opened your app, you could only see your what was on your bank
only
account.
on your account, yeah,
only on your
the
account.
total.
And during the years, it forwarded, and that you can do more. And I think that's also a good way to look at it. If you
Step by step.
Step by step, but with concrete steps, and also know where you want to end.
Okay. You talked also about the corona. Can I have some light in the room, please? You talked, because we are going also to the audience, you talked also about a corona period in your speech, and you mentioned Peter O'Halloran, and he told us that, for instance, Indonesia did with the corona app, which not a lot of countries did. They used it as the start of to make it an EPD for everybody in Indonesia, and it works now over there. Don't you think that was also a splendid idea for the Netherlands?
Yeah, but we didn't.
Yeah, but we skipped it, isn't it?
No, but I think that also has to do with the history of the electronic patient file. And in the Netherlands, we have a trauma about that period of time. So it's not easy to make some progress when there's a trauma.
Yeah, and it wasn't trustworthy for a lot of people. And
yes,
that's
yes.
what you mean.
And I think with the COVID pandemic, what you have seen in the Netherlands, there was a lot of distrust also in what the government was doing. And that's also very different in every country. So,
okay.
You know.
Questions from the audience, please. Wave, otherwise, because you are with so many, I can't see you.
It's still early for people to ask questions, maybe.
You're still a little bit asleep? No questions?
I don't really mind.
No, you know, it was a good story, so I wish you a lot of luck, because it's, I think if you want to have global harmony in the healthcare systems, that is what I wonder. What takes the organization which you chair now tick?
What
makes it tick that everybody wants to collaborate together?
Yeah, because you see that the challenges in every country on healthcare are the same. People getting older, people needing more care, but we don't have enough people to take care of them. And a lot of time is being wasted on administrative burdens. And that's the same in every country. So what I see in that group is that everybody is really willing to make a change and to make sure that healthcare stays accessible for everybody.
Okay. I wish you a lot of success.
Thank you.
Thank you, Abigail.
Thank you.
Abigail Norville.